Thank you for making the time, Doctor. We are exactly 2 weeks away from the opening ceremony. Where are we at right now as athletes start to arrive, as broadcasters start to arrive? What is the current status of the COVID situation from the reports you're getting?
Well, at the moment, we're starting to see people arrive into Beijing through the protocols that we've put in place to get tested, etc. At the moment, we are seeing, as we expected, slightly more than cases than we might have seen in Tokyo because Omicron is different to the Delta we had before. But the system itself is working in the sense that's picking up people who might be infectious and might get into the village and cause a problem. And now we're having to work out how we deal with those cases and get as many people as possible into the games and as many people as we can do safely.
Doctor, I hear you say more cases than expected. What was the number expected? Is there a quantifiable number or a positivity rate you can give me?
No, not at the moment, because we're only building the numbers up at the moment. But we expect it will be a bit higher than we saw in Tokyo, for example, because we're dealing with Omicron rather than Delta. What we expect to see, and I think it's what's emerging at the moment, is that at each stage of the testing, from the pre-departure to the airport testing to the testing in the village, we see less people at each stage. And within the closed loop system at present, the positivity rate is quite low. So we're not seeing problems inside the loop at present, but we are managing some people who test positive at the airport to see what we can do to help them get through the system safely.
There is a rigorous protocol and requirement and procedure put in place should anyone test positive within 30 days of departure. Can you walk me through, Doctor, how these protocols came to be? Was it led by the IOC or was it led by the Beijing Olympic Committee?
It emerged as a partnership that we've been talking about for many months, building on what we learned from Tokyo and applying it into the specific context of China, because there are obviously differences in the way every country handles coronavirus. So we've been evolving it. We are using a standard PCR test, which is an international standard, World Health Organization approved. Every laboratory sets its own standards in terms of CT values, but these are consistent across the world. So it's not a particularly different test, but what we have done more recently, they've brought in doing the test twice with different reagents and using different what we call gene targets to look for. That gives us more information to try and judge whether something might be a false positive or a false negative. So we can now be more confident that we're not seeing false positives.
Doctor, I can appreciate that this is an international standard. It isn't the standard in Canada. In many health jurisdictions here, we know that number is lower than that 40 CT. I've talked to infectious diseases specialists here in the country who say that is high and that there is a potential that you could produce upwards of 5 negative PCR tests in Canada, arrive in China, and because of this higher number, test positive. What happens in that situation?
Well, the first thing to remember is what we're trying to do is make sure the games are safe for all the participants inside the closed loop system, as well as for the population of China. So we have a test which is designed to be sensitive, to make sure it reduces the chance that anybody who might be incubating coronavirus gets through that system and into the village. Now, the normal challenge with that is you then get false positives, where people are excluded from the games for a positive test, even though they are not sick. And that's why we brought in the confirmatory tests, the extra reagents, the extra gene targets.
You are the head of this medical expert panel, which is going to adjudicate what I believe potentially many cases because of the situation that we're hearing in the early days. What do we need to know about this medical expert panel? As I understand it, it's comprised of 20 people. What is the composition? Who is on this panel? And what is the level of subjectivity when it comes to adjudicating all of these cases that will be put toward this medical expert panel?
So the panel is similar to the panel that we used in Tokyo. It's similar to panels that sporting events around the world, Formula One, etc., have used over the last year. We have a combination of public health, virologists, infectious disease experts from within China, and a number of experts from around the world from outside China. And we sit and discuss what does the evidence tell us about what is safe to do and what is not. So somebody can submit their test result if they're not happy. We can look at the history of the test they've had done before. We can look at the CT values, as you say, to see are they changing, are they going up, are they going down. We can look at their vaccination history and try and make that judgment about whether this is what we call a persistent positive test in somebody who probably isn't infectious, or is this evidence of a new infection or a reinfection, in which case they are a risk to the community and the village? And we try and make that very fine judgment based on the best science we can find.
I've received phone calls from Canadian Olympians last night who are concerned about what awaits them when they arrive in China regarding their PCR tests, regarding the fact that they have tested positive within the last 30 to 45 days. What do you say to them to calm their nerves about what they might face when they arrive in China with the unknown that they perhaps could test positive, and then what?
Well, first I would say, yes, it's a risk, but the risk is not that great at the moment, with positivity rates around 1% or so at the airport. So that means 98, 99 out of 100 people get straight through the airport with no problems. For the 1 or 2 who are left, then what we're trying to do is say, okay, you've now tested positive, you may have to go to isolation. If you've never had COVID before, you've got no previous positive test, you test positive at the airport, the reality is you probably have got infectious coronavirus and shouldn't be allowed into the village. If you have had COVID before, if you have had positive tests, then the panel can sit and look at the pattern of the CT and try and make that judgment about whether you're getting better or whether you're still infectious. And then we look at it and say, okay, you might still have a positive test, but maybe we can let you out, but we put more restrictions on you when you come out. You have to eat alone, you have to travel alone, you have to train alone. But we try and put a system in place that will allow you out, will allow athletes to compete and train, but will also protect the people around them. So we are putting stages into it that gradually gets people out of the isolation problem, back into the games, but doing that in a way that we think is still safe.
I'm so glad you mentioned that, because of course there is a domino effect to all of this, isn't there, because of these close contacts. And so I wonder, in the cases of a person who has 30 days ago previously tested positive, but then is on a flight over with fellow athletes and colleagues, it does have a domino effect. So what sort of procedures are put in place in that situation?
Well, I mean, we've been talking to international federations and national Olympic committees just to say that very point. You know, we will put in place a system that will try and help you do this. But you also have to make a judgment as a team manager, if you like, to say, if this person is testing negative on Tuesday and positive on Wednesday, and we put them on a flight, and they test positive at the airport, then the contacts sitting in the plane around them are going to be excluded from the games for a short period while you sort this problem out. And that's a risk that the team have to recognise and manage. And they have to say, okay, if I take that team out, have I got a replacement? Have I got a backup? So people have to recognise this is a live pandemic situation. There are risks involved, and they have to plan both to reduce the risks and to manage them.
Chinese athletes who are already in the country, of course, we know all these protocols are put into place for people, for the world arriving in China. Are these same requirements being put to the Chinese athletes who are in the country already?
It's the same requirement to get inside the closed-loop system for everybody. But it's also important to remember that athletes who are living in China probably have one of the lowest rates of coronavirus around them than anybody in the world. So they are much, much, much less likely to test positive than somebody traveling from the UK or from Canada, for example, where Omicron has been everywhere for a few weeks.
What specifically are you going to be paying attention to over this next week, and what concerns might you have over this next week as we get closer to the cauldron being lit?
I think the main issue for us is going to be learning as we go along about the decisions we make to let people in or out of isolation and try and refine that. So going back to our conversation about countries who've moved to 5 or 7 days isolation, we will look at results coming in on a regular basis, examine all the tests and see, have we loosened the tap too much or tightened it too much? Can we adjust it slightly? How do we make those individual adjustments as we go along and build up our experience?
And that conversation will happen between the IOC and the Beijing Olympic Committee, who has the final say on whether policies evolve.
So I think it happens inside, It initially happens with the expert panel, so the experts come to our own view about what the science says, and then we talk to the authorities in Beijing about that, and we give them our advice.